everyone. Welcome to the program. This is Sunday Politics, live on Channels Television. I am Sean Kimaloe, live here in Abuja. Let's also tell you now that the meeting of West African leaders have come to a close. In that meeting, the President, Bola Tinubu, is saying that there's a need for a united front and a collective action to address the challenges confronting the West African region and the continent at large, because terrorism, violent extremism, and unconstitutional change of government is troubling the region. This was part of the welcome address delivered by the Vice President, who represented the President at the 68th Ordinary Session of the Economic Community of West African State ECOWAS Authority of Heads of State and Government meeting, which took place at the State House Conference Center here in Abuja. And a bid to make mobility, opportunity, and inclusion accessible to all in the region, there's an announcement that beginning from January 2026, the community will implement a landmark measure to reduce the cost of air travel across West Africa. Under this agreement, member states will abolish air transport taxes and reduce passenger and security charges by 25%. The meeting came in the wake of a successful foiling of military takeover in Benin Republic a week ago, as rattled regional bloc in the ECOWAS. And now we've officially seen the Taraba State Governor Kefas, who have officially now made the crossing from the PDP to the APC. He received his membership card from his ward chairman in Wukari local government area of the state, and supported by other APC executives. The governor assures of transforming the state and ensuring inclusive governance for more dividends of democracy. According to the governor, a new date for the official defection into the party will be announced soon. The governor had postponed his defection scheduled for November 19th following the abduction of school children in Kebbi State. Well, that leads us, everyone, to our major conversation tonight. And our focus is on the health sector. Is once again under intense national scrutiny. Is renewed industrial actions by medical professionals expose long-standing challenges around funding, workforce welfare, and service delivery, from overcrowded public hospitals to the persistent migration to skilled health workers. The system continues to strain under rising demand and limited resources. But in the wake of the Bola Tinubu administration, they say they're promising public health sector reforms, and in response to all of this, the government says things are not going to be the same way they used to be. The federal government says it is implementing wide-ranging reforms that's aimed at strengthening primary health care, expanding health insurance coverage, improving working conditions for health professionals, and enduring and ensuring that quality care becomes more accessible to Nigerians across all states. Beyond the health sector tonight, political conversations will also come up and also gaining momentum in Bauchi State, that we're seeing with early alignments and speculations ahead of the 2027 governorship election is beginning to shape public discourse. Tonight, we'll be sitting down with the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, who is live for us here in Abuja studio. Many thanks, Honorable Minister, for joining us tonight.
Thank you for having me.
Thanks so much indeed. You've traveled quite a lot these days, from Japan to Brussels, and a few of your travels have had to do with what you are doing on the ground. There are a lot of promises that are being made. The health sector is supposed to be one of the low-hanging fruit for the Bola Tinubu government. I saw live for myself how from every local government there is an impact. People got gainfully engaged. But beyond that is whether or not our lives are better in terms of accessibility to public health, whether or not the reforms that you have talked about, and you are reform champions, and you said that is going to be your agenda. Cancer center, are they functioning well? Healthcare insurance scheme, are they working well? These are some of the issues I'd like to take personally with you tonight on the program. But give us an understanding. Where are we? At the year ending, there are a lot of promises that have been made. What would be your latest that you want to uncover for Nigerians now who are watching?
This Friday was exactly 2 years since President Bola Ahmed Tinubu unveiled the Health Sector Renewal Investment Initiative publicly, and the compact that was signed by all the 36 governors and 17 of our development partners to move in the direction of improving the population health outcomes. The 4 pillars were the governance, the health systems to be efficient, qualitative, but also to unlock the value chain and to enhance health security. Across all those 4 domains, we have reviewed our progress in 2024 during the joint annual review, and I came to your show to expound on that. More recently, in November, we again reviewed the progress we've made. So we have 2-year track record, and I'm pleased to say that we're beginning to see progress in many of the areas that we have laid out. If I go on the governance side, I think the compact is in place. 20 out of 36 states have improved their performance in 2025 compared to 2024. We're seeing more civic engagement, citizen engagement is improved. The confidence of the Nigerian citizens, when we surveyed using the People's Voices survey, more than 67% of them were confident in the capability of government to respond to health emergencies. So the governance pillar has raised resources, has focused on our citizens' needs, and is beginning to move. On the health system itself, expansion of primary health care, when we came, it was more than 8,000 that were receiving direct facility financing through Basic Healthcare Provision Fund. We've improved the flow of funds. We've increased by 5,000 more the PHCs to receive direct facility financing, expanding the utilization of healthcare services. In the first half of 2025, more than 80 million visits were done to those basic healthcare provision facilities all over Nigeria, compared to about 20 million, let's say, in 2023. So almost a 4-fold increase in utilization. We've immunized 59 million children in the most recent campaign, Integrated Measles and Rubella campaign. We've seen tick-up in routine immunization, increase in antenatal coverage, but also skilled birth attendants. And importantly, when we picked maternal mortality as an area where we wanted to make a difference, between 2023 and 2025, in the 172 local government areas that have the highest burden of maternal mortality, there's been a decline of 17% institutional data compared to the baseline, not population data. There's an important difference there. And newborn mortality by 10%. So I would say that on the supply side, we're seeing improvement. And on the demand side, affordability, the expansion of health insurance coverage, I think we have crossed more than 21 million for the first time. When we started this conversation, we were less than 16 million. More Nigerians have health insurance coverage. Not nearly enough for the 230 million, but we were on a move that is upward. And the Vulnerable Groups Fund has been expanded. Do
you know, Minister, can you tell Nigerians how many Nigerians are covered under the NHIS program as of today?
Yes. I think there are about 7 million that are insured in the formal sector, and 2.4 to 3 million are insured under the Vulnerable Groups Fund. There are others that are insured in the private sector window. But NHI is a regulator. And over the time that we've been changing the NHIA to be an effective, efficient regulator, enrollments have ticked up in collaboration with the state health insurance authorities and the National Health Insurance Authority, and also through the private health insurance. So overall, what we are creating is a larger risk pool, which has to be, even our aspiration is to get to 50 million Nigerians over time. But somebody has to pay for that. The premium, you cannot expand insurance just on paper. Somebody has to pay the premium.
My big question here is that a lot of things that people will make an easy comparison, and what you will enjoy in being a citizen of the UK, of the United States, and in some other developed countries, some of the basic things that your social security will cover is the quality and the immediacy of healthcare. The kind of education that you will get, even if you fall from the skies without parent and anything. In other climes, you must. It's a crime for any parent to harbor any children that is not going to school. And these are basic things that in other climes, they are fundamental. Why has it been so difficult? I know you have your eyes for about 50 million, but less than 20 million Nigerians are still covered.
More than 20 million.
More than 20 million. So now, in that sense, why is it so difficult to get Nigerians enrolled?
So you have to be careful when you translocate other country experiences with ours. In the UK, for instance, there is no National Health Insurance Authority. There's the NHS. Theirs is a tax-based model. Government provides the resources to provide for everyone. We have a little bit of that. What we provide through primary health care, for instance, is tax-based. It's government revenue financing that, but not an insurance. Insurance, the private insurance is an optional that people can add for other things. But you see the rationing that is happening in NHIS, for instance, the time it takes to get services, the delays in terms of scheduling, and it's a system that has delivered tremendously for the UK population in the context of their system of governance, a unitary system, a parliamentary system. Ours is different. Take the United States. Lately, you will know the challenges in terms of even the Affordable Care Act, the Obamacare, because there are more than 50 million Americans who are uninsured or underinsured. And the cost of insurance is high because that's the nature of their system. They spend more than $14,000 per capita on health, and see where they are struggling. We spend less, much less than that. We're trying to stretch the little resources that we have to ensure we cover the poorest and most vulnerable and incrementally move on that. And with the reforms of the president, with the additional revenues that we expect in the years ahead, those resources can be channeled more to provide coverage for more and more Nigerians, because you cannot cover population without paying the premium. And the public has to take the responsibility to pay that premium. But it has to also be on a sound regulator. That's why NHIA is the regulator that has now increased the tariffs for capitation, for fee-for-service, and to give it the teeth. So the providers take it more seriously.
So, but my worry is, why is it so difficult? What is the NHIA telling you about the difficulty? I've spoken with the director of the NHIA at some point on the program. And I mean, more than several other years that we have experienced, there is an incremental progress in enrollment, but it's still very sluggish and looks very difficult to. Why the difficulty?
So if you take 50,
is it education or what? What exactly
you take 50 million Nigerians and you compute the premium and you multiply, there's a quantum of resource available by the federal government but also the states to be able to pay for that insurance. And that's the mechanism has been developed. And I think that is a key challenge. Now, I think we're expanding the vulnerable groups fund through BHCPF with the resources available to us. And as more resources become available, because this is not just one-off. When you enroll someone, you will continue to pay for those premium. And that is something that we have been making progress. But beyond that, there are other elements on maternal health, for instance, and emergency obstetric services, that women with cesarean section have those reimbursed, more than 20,000, making a huge difference. Fistula, but also at the higher levels, you mentioned the cancer centers. I think 3 of the 6 have been completed, the 3 are on the way. Many physical infrastructure in our teaching hospitals are also being revamped. Despite all the difficulties in liquidity and all of that, I think we're making steady progress, as well as the human resources.
So that's what I was going to ask you, because anyone watching tonight, they know you're a professor, and hardly will you be able to mince your words in defending some of the policy have been designed and the strategy of this government in achieving some of the renewed hope agenda in the healthcare sector. But you know what they care about? They don't want the Turenchi like what they say in the local parlance. What they want is the realities, what they can get. For example, what can we say Nigerians can benefit now that we have the Tinubu government? Accessibility to health, what is different? The cancer treatment, those who, after my program with, I think, who was it? One of the senior members in your ministry who said that the cancer centers are now spread in different regions of the country. But there are those who say it's still very expensive, accessibility is still difficult. I know fistula treatment, the issues of child birth and all of that. These are easy areas that Nigerians will want to know. Malaria treatment, what are the things that are different that you can tell us? The low-hanging fruit, what are we getting from the Tinubu government?
Just, if people just listen through the noise, they'll hear the concrete things. First of all, the depravity in the health sector for 20 years or more. In 2 years, we've begun to turn it around. We're still a long way from solving all the problems. But the fact that more than 80 million visits took place to primary healthcare centers supported by the federal government compared to 20 million for a commensurate period in 2023 tells you that there is more traffic. The fact that 73,000 frontline health workers have been retrained, the fact that all the states of the federation have also geared up.
Or maybe more Nigerians have been sick.
Well,
it is not traffic.
But utilization at primary healthcare level, a lot of it is preventive, it's dental care, it's immunization, it's treatment of basic ailments. If folks stay at home, what does it mean? But in terms of morbidity, what we're seeing is decline in maternal mortality. That is a piece of good news, that unless someone is closing their eyes, when I say 17% decline from 2023 in this 172 local government, that's a start, that's some good news. When I say neonatal mortality is showing a trend towards going down, when we're saying increase in antenatal care and immunization, these are very tangible. And if you survey Nigeria, not pundits that are sitting in rooms, but actually ask through People's Voices survey that we have done in 2023, 24, and 25, we see Nigerians also appreciate that. Is it solved? No. We cannot solve, let's say, in just 2 years, what have been long-standing issues of underinvestment and structural defects in the Nigerian health system. But what I am sure people appreciate is that there is a steady move towards improving the health system that we have, and we need to rally around as a country and deliver on that. The third pillar that I had mentioned is unlocking the healthcare value chain. Now, Shun, before we came, we had been very import dependent on almost everything. 4 days ago, in Ogun State, the first dual active ingredient insecticide manufacturing plant, the groundbreaking took place in Nigeria. 2 years ago, you would say it was impossible. Even last year, someone would say it is impossible. This is the first time that such a latest technology that will produce bed nets, that are dual active ingredients that will help us deal with malaria. More than 1 billion nets have been distributed all over Africa, none produced from Nigeria or from African countries. Now we have that plant here. There are many of those that are beginning to happen. So it's not, it's very tangible. You can go and see the plant. Rapid diagnostic kits, pharmaceutical plants that are expanding. There are tangible things that are happening. On the fourth pillar, well, in health, when there is bad news, oftentimes that's what takes the day. When there is huge cholera outbreak or meningitis outbreak or measles outbreak, if you notice in the last 2 years, those outbreaks have been minimalized because the CDC, the public health system, together with states, have been very vigilant in surveillance with the support of our partners, testing quickly whenever there's an issue. There are many scares that happen. We quickly rally around, look at it, try to contain them before they expand. Those are successes, but they are successes in terms of the badness that we did not allow to propagate. Even when there was diphtheria in 2023, there are 14 states that had diphtheria all over the country, if you recall, in August 2023. Now nobody's talking about diphtheria. There are still cases, but it's much lower. Meningitis, it used to be a big issue. Last year, we were the first country in Africa to introduce the pentavalent conjugate meningococcal vaccine, and it stopped that outbreak in its track. Mpox, you hear it in some other places. We have few cases, 40, but we don't have the kinds of explosion.
Yeah.
Cholera, 2024, there was massive cholera outbreak. This year, there was proactivity, Ministry of Water Resources, states, CDC, to be sure that we're secure, we protect public health. So those are all tangible areas. And these are what the rest of the world is recognizing. When we went to the high-level forum on universal health coverage in Tokyo, there are only 8 countries that were in this group. Nigeria is one of those. And the government of Japan, World Health Organization, and many, many other global institutions appreciated the reforms that this president is putting in place in health over the last 2 years. Not yet out of the woods. We need to push along as a country, and we need to continue to work towards refining our system to be better in responding to our needs.
One of our biggest worry or headache in this part of the world is malaria.
Yes.
And the vaccine news came and everybody was excited. The last time you spoke about it on this program, and you said it's still an emerging story. What is the latest on malaria vaccine? How soon could we get more? And how rapidly could it go around the country?
So you have to understand, that this is the first vaccine that was actually rolled out for malaria. There's a second one also available. We had 1 million doses tried in Kebbi and Bayelsa. It is a 4-dose vaccine. What we noticed is the first dose uptake was high, but subsequently families were not bringing their children for the second, third, and fourth doses. But remember, in the armamentarium that we have for fighting malaria, there are things like bed nets, very cheap, very effective in repelling the mosquitoes. There's seasonal chemoprophylaxis, which children have it, and there's case management, which Lagos, for instance, is in the pre-elimination stage. You may not believe it, but Lagos is less than 5% positivity rate compared to 90% in the past. Amazing success. Kudos to the government of Lagos State and the commissioner. But it shows what is possible by expanding case management, expanding testing, and also dealing with the circumstances that will allow mosquitoes to grow. In the Council on Health that we held in Calabar, we passed a resolution to include larvicidin as a tool to reduce the larvae for the mosquitoes to produce. So there are many tools in our fight to malaria, to deal with malaria. And just this Friday, the advisory group on malaria elimination in Nigeria came, and we had extensive engagement with them. They looked at our strategy, they looked at our progress, and they commended this government, this effort that is being put to address malaria, which is putting it way ahead of other countries in our region. But it is still there. We are facing few challenges. Let me tell you one. Population growth is continuing. We are dealing with malaria, but also we are continuing to increase in terms of numbers, which is good. But at least that is a reality. Secondly, climate change. Because of changes in climate and the patterns of rainfall, it becomes possible that areas that may not have the seasonality becoming really pan-seasonal in terms of malaria, and other malaria vectors might come in to the area. We don't have much evidence of that. And then resistance, because people are not taking the right medicines, the quality medicines, and the mosquitoes may have resistance and they can be spread. But we're dealing with that through strengthened regulation, but also locally manufacturing good quality medicines and making them affordable. So it's a fight that you cannot, for more than 78 years, Nigeria has had a malaria program. There have been several efforts to kick it out of the world. And we still have this stalemate. But in the last 2 years, despite the financing difficulties, this government, again, alongside our states and our technical partners, have put in a mechanism to accelerate Nigeria's progress. And I have just told you about the Bennett. I'm very excited about that because it's double active ingredient insecticide net, which, regardless of resistance, it will work.
I just pray that it works, because globally, Nigeria still accounts for about 30% of malaria-related deaths. That is still very high.
You see, sometimes we quote those numbers almost with pride, but in reality,
it's a sad data.
But they need to be looked at. They need to be looked at very carefully. I was speaking to a very important expert who is on evaluation. And he said, look, much of the data that you hear on the global stage being quoted on your country, when you look at it critically, you may find that you're actually doing far better. But the narrative is easy to weave on the basis of, 30%, 30%, 30%.
Maybe because we don't originate some of these data ourselves.
And that's why we're fixing our data systems. And that's why I said we had the joint annual reviews, independent monitoring mechanisms, and I'm telling you that we are making good progress. And beyond just the numbers, the statistics, I'm saying for the first time in second quarter of 2026, there will be dual AI active ingredient nets produced in Nigeria. It has never happened. That allows us, as country, to afford that. And there are other net producers that will come in and will encourage everyone so that we deal with our issues.
Yeah. There are quite a few. I mean, I'm concerned about this conversation tonight, concerned about some of the successes that have been made.
Yes.
If you're not careful, the noise will overshadow some of the successes. You will see a 17% improvement in maternal mortality rate compared to about 2 years ago, which is an improvement. And it's not like it's not happening. But you see, the figure's still not comfortable.
Yes.
And I know a lot is being done. And I'm also worried about those who have good, who don't have the good jobs, whose poverty is debarring them from getting the kind of health care, who the location where they live and the accessibility to health is still pulling them back. I'm concerned about these people. What are we going to do to drastically reduce that maternal mortality rate in this country? It's still very high. A lot of work is done. Yes. There is a 17% improvement from the days that I've seen, but there's still a far way to go.
Absolutely. We're a very unequal society, Nigeria. Generally, inequality is a feature of the Nigerian economic space. You look at the Gini coefficient of Nigeria, it's one of those that is high and is uncomfortable. We have to think of those who are the poorest and vulnerable amongst us, especially in difficult times like the ones that we have faced behind us. That is precisely why we targeted our interventions on the front lines, on the primary healthcare system, where rural areas, urban areas, the issues that are to do with the commons, dealing with malaria. We're not talking about plastic surgery here. We're not talking about a high-end, highfalutin lung transplant or anything like that. We're saying, let's deal with immunization. Let's make our people aware. Let's improve mothers to have antenatal care. Let's have frontline health workers equipped. So let's have a supply chain actually functional. Let's produce quality medicines for them. That way, we're addressing their needs and finding where they are. And of the 88 million that I mentioned who have utilized primary health care, I bet you a large majority of them are not in your class, Sean. They are not Abuja folks who are wealthy. They are folks out there who are looking for help. And government, working with states, has been able to provide avenue for them to seek care. This has never happened. It is beginning to happen. Has it solved all the problems of quality, of human resources, incentive? We haven't fixed all of them. But at least there are some areas that we have begun to fix. And we should stay steady on that and fix them. Because that's how we build a healthcare system that we want.
I'm excited because the other day I was talking to your colleague, the Ministry of State, and I know that you've made effort in bringing someone like Dr. Leke, who works with your ministry on digital health.
Yes.
And we are able to see and we can track, you can book appointments with doctors in different medical. I mean, these are improvements, things that you may never be able to achieve in Nigeria. I mean, we talk about jackpot Nigerians are living. But the case of the Dr. Leke, for example, is the one who Harvard trained who you brought to the country for this kind of effect. And it's exciting that those kind of good stories are in the pharmaceuticals, in the medical equipment manufacturing. Things are happening, but they are just not enough. The capturing of those who are in the informal sector. Because what is important is that anybody should have confidence that if I'm sick, I don't have a problem. I need to just walk in the place and be able to get treatment. Capturing the poorest of the poor and making them know that even some of these simple treatment that kill them, there are things that they can easily get access to in the local government, in the ward, in the state, are easily accessible. These are the gaps that I think that they are low-hanging fruit that need to be met. Even childbirth is so advanced these days that people should not be dying from having children.
Absolutely. And that's why when I say more than 3,000 level 2 facilities have been revitalized in the last 2 years, that's very positive. These are rural facilities, operating 24 hours, with staffing, with housing for them. This is part of the PhD revitalization. It has happened. If you go to MPHCD website, you will see those facilities and you can track them. That is to make it available to people. It wasn't done before. Now it is beginning to happen and we should continue to do more of that. But another point that is important is to say in the context of inequality and not enough public resources being put in health, we have a mixed health system. We have a private sector that is also a contributor in terms of service delivery. I bet you most of the folks here in your office, when they are sick, they probably will go to a private facility. So the private sector is also kicking up. Recently, here in Abuja, I commissioned a robotic surgical platform. And I saw it. You will think that robotic surgery in Nigeria, well, it's happening. It's happening here. There are many private players also investing. So for those who want premium service, they still have where to go. But for the bottom of the pyramid, I think we have to ensure that the public resources are available and everyone else can opt to use the public facilities. And I believe that if we do that, we'll get the health system that provides options to people, but guarantees access to everyone, but requires money. And that is the issue. Health is not cheap. When you talk about UK or US or Europe, you have to look at how much are they spending in the health sector. When we don't spend enough, that is societal consensus, and that has changed. Less than 4% of the federal budget was in health before President Tinubu. Now it's more than 5.2, 5.4%.
That's still not enough.
Well, it's going to go up again. I think that's the intention, and we will see at the end of the appropriation 2026 where we land. But at least we've bucked the trend. We've never gone this high level of prioritization. That is something to celebrate. And in fact, when we spoke to the governors on Friday, the 2.6 trillion that cumulatively all state governors invest in health in 2024, for instance, we're asking that they should meet up, also match what the federal government will do, so that as federal government increases its resources, states also increase, and we're better efficient in mobilizing the private spending to purchase the health services that we need as a population. And I think that's the direction that we should
Give me a moment, Minister. We need to go on a break. But when we return, Honorable Minister of Health will be speaking to us about what the realities are, the promises of the Bola Tinubu government when they came into office. In the last 1 year, what has changed? And you can testify whether your life has changed. The Jackpot syndrome, the medical doctors who are Nigerians by name, by identity, by training, who are the ones fortifying other economies. What do we do when our own healthcare system are faltering? Plus, with this man sitting with me tonight be the next governor of Bauchi State? There are a lot of talks about that. That's going to be after this break, everyone. Join us again. Stay with us right on the program. Professor Mohammed Ali Pate is a coordinating Minister of Health and Social Welfare in Nigeria, and it's been my guest on the program tonight. What is the state of affairs in our health sector? President Bola Tinubu made bold promises at the campaign, and when he appointed Professor Ali Pate, he came with a very strong resume. This was a man who was appointed on a global stage for a very juicy job, like a lot of people who said I could give him a lot of dollars, but the man said instead he wants to come back home and serve his fatherland. But has he been successful in doing all what has been burden on his shoulder to perform in his office? And that's what we're asking the question tonight. Thanks so much, Honorable Minister, for your time tonight. I'd like to ask you, and the incessant doctor strike and agitations within the health sector, and the workers who are agitating about welfare and all of that, and a lot of Nigerians are wondering when will this end. And there's a sad story today. I only heard today. My plumber, I had a little water issue in the house, and the plumber came, and he said, I told him I've been trying to reach him. He said, due to doctor strike few weeks ago, a few days ago, he said he lost his daughter of 2-year-old, and that he couldn't afford a private hospital, and they rushed to the public hospital, but the doctors were on strike, and he lost the child. That's painful. That is the pain of going to the hospital and not being able to get people to attend to you. And this kind of sad story should never be happening in our country.
I agree with you. I completely agree with you, and I condole your plumber. It's unfortunate, and that's the message we're sending to all health workers. Health profession is a very unique one. Nobody should just get in and be carried away to behave in ways that are not commensurate with the core ethics of the profession to save lives. And whatever issue that existed, there are always issues that can be negotiated. Even after strikes, it's negotiation that solves them. I have to say that in the last 2.5 years, we experienced relative harmony. We have not had major disruptions in services, except for the period where resident doctors, not the medical association, not the medical and dental consultants, only the trainee physicians, the younger physicians, who took on issues that were legacy issues for a very long time, long litany of issues that they brought to the fore, some of which were germane, some of which were addressed, some of which ultimately had to be negotiated. So it's unfortunate, and we hope that they've learned an important lesson, that in fact, you don't take a country hostage. You also agitate for your grievances and sit around the negotiating table and resolve those issues in a responsible manner as a professional group.
But the question here, Minister, is whether or not the government also have taken them for granted over the years. And it's whether or not these guys can die in silence if the government is not serious about their welfare. These are the issues.
Let me tell you that there were outstanding arrears from 2023, which amounted to 50 billion. Those were dispensed with. Minister of Finance was able to deal with them. There were medical residency transfers for 10 billion. Those were dispensed with. There are other issues of agitation around allowances and increments, which the Secretary to the Government convoked a collective bargaining agreement mechanism, which is known in labor relations, which is underway. There was an interim understanding to have a job evaluation so that if you're going to increase, particularly on issues of relativity, that how do you do that, taking into cognizance the training and also the work that folks are doing. You don't do things like that just offhead. We looked at the whole regions in this, the African region, asking the World Health Organization to come in and tell us how do Nigerian health workforce compare relative to others, so that we are informed how we remedy, because it's in our interest for us to have well-remunerated, incentivized, comfortable health workforce to deliver on the agenda. Thankfully, the Medical Association, the Nurses and Midwife Association have all understood that. And I think the issue with the residents has now been resolved and they're back, and it's unfortunate any loss of life that was caused because of that. But still, I wouldn't use the word incensed. The Johesu issues, which is the Joint Health Sector Union, the others, also the doctors and nurses, they are a separate block. That is on the way, and there some of the issues have a long history behind them, and we are engaging through various channels to see how do we come to a common understanding as we engage on the CBA, so that at the end of the day we have a fair settlement, because you cannot expect that all that you ask for has to be done. It's only a child that will think that when I make a demand, I make a tantrum, all my requirements has to be met. It's give and take. There's the constraints of government itself, there's constraints of federal government relative to the states, there are also constraints of civil service and regulations that exist, but within that, if we all lean in constructively, I'm sure there is nothing that is not resolvable if the spirit of give and take is there. And we're encouraging the health professionals, and we thank especially the leadership of many of these that are really have understood this, and I believe across the national leadership, but also the sub-national leadership of those associations, many of them really reason with this government, seeing the huge effort that President Tinubu has put in transforming the health sector. I think that's...
Quickly, I see that there is a reduction by about 52%. Those are the data that I got about medical tourism and those who are seeking medical care abroad. One leg of my question in that regard is that, do we now have public hospitals that are sufficient, effective enough to treat our leaders in the country that we do not have? Because medical treatment is also some kind of security, because if you subject your leader into the hands of foreigners in a foreign land, it's a form of security. Can we say, as of today, there is no disease that can befall any human who becomes a leader in this country that Nigeria cannot take care of?
Let me tell you a personal story. My own father, the person who brought me to this earth, who groomed me, sent me to school, and gave me my name and everything that I am, he had an emergency about 8 months ago, a critical surgical emergency. Lots of pressure. Take him to Egypt, take him to this place. Oh, I said no. We took him to a public facility. He was operated upon. He got better, he got discharged, and he's back on his feet. There are many examples that I will say. Sometimes folks go to other countries for medical care because they don't fully appreciate what may be available at home. Because you may go to Egypt or India or other places, but the care that you may receive there is probably available here. And I've seen exceptional surgeons and medical providers here in Abuja, in Lagos, and many other parts of our country. In some of our teaching hospitals, like University Medical Teaching Hospital, I've seen people coming from the sub-region, from neighboring countries to that. Even here in Abuja, there are folks coming from the UK because they cannot wait to get an MRI in those places.
The list is very long for you to be able to get some procedures
so
done.
In Lagos, the same. You have one of the best-in-class orthopedic surgeons, Dr. Julius Oni, who came back, and he told me he had 50 joint replacement that he did in Lagos within just a short period of time. Of course, he needs to be encouraged, he needs to be supported, but this gives you the example of what is already happening. So when you hear the numbers from the central bank, the reduction in medical tourism is because Nigeria are waking up to look.
But my question you've not answered, Minister. Can we take care of our leaders when they are in medical need?
I think we have the facilities to deal with medical emergencies. There are facilities either in federal teaching hospitals or some of the facilities that are built in our system that can be able to handle many emergencies. But people travel for different reasons as well. Sometimes it's long history, long connection with the providers.
But the president, I mean, is the State House Clinic, I know Dr. Obalumna heads that State House Clinic, fantastic medical doctor and lawyer who heads it now, but I don't know if it's effectively been equipped, because you've had a lot of corruption issues over the last government, how much of money they didn't spend, but is it effectively working to take care of?
In this administration, I will tell you that every investment that is required is being made to ensure that we have the facilities that will deal with emergencies. People can choose for different reasons, historical reasons, medical records. So if you've had surgery, for instance, 10 years ago by a provider in Ghana, it's logical that you want to go back to that provider, not because you don't respect, but if you have a new issue, it can be tackled here. And
quickly, Minister, I'd like to know, I know we have a lot of Nigerians who travel abroad for heart surgeries, kidney transplant, and some brain surgeries, but we are increasingly having capacity in Nigeria. But those who think that we should have legacy or centers of excellence where we have these areas of expertise and Nigerians can easily go there rather than having all of the hospitals that are major centers that wanting to specialize in all areas. Is this the thinking of the government?
I think, yes. The area of quaternary care, I think, is where we should be going, but it requires investments in physical infrastructure, in world-class equipment, and also in the talent. Some of our hospitals have already developed some of those specializations, some of which are transplant, for instance. Sokoto does it, Ife is trying to do it. In oncology, there are some of those specialized areas, which are the main areas. Orthopedics, for instance, we have national orthopedic hospitals. There are new ones that have been created. Eye ophthalmology, we have national eye hospital, ear hospital. So there are those specializations that are available. The issue is that many of us don't really know the depth of what exists in Nigeria. And so we run around without knowing that there are certain things that we can get here. Although sometimes issues of confidentiality someone may say, oh, I don't want to be treated here because I don't. Well, that is someone that an individual can decide. But at least there are some of those facilities and qualified. I'm really amazed by the quality of the Nigerian practitioners and surgeons in many of the hospitals that I've encountered. Some of them trained abroad and came back to serve within hospitals here in Nigeria.
Just for another pause, Minister. We'll be right back after this break. And whether or not Minister Pate wants to be governor, we'll be finding out after this break. Thank you so much, everyone. In the home stretch, we just have about 60 seconds to close the program. Minister, you've wanted to become a Bauchi state governor. And there are talks about your name is being coming up over and over again ahead of 2027. Is that something that you're thinking about?
Well, I'm 1,000% focused, committed on delivering on what President Bola Ahmed Tinubu assigned for me to deliver in terms of health transformation. I'm also 1,000% committed to helping President succeed politically. And in terms of Bauchi, I know that all of us stakeholders in the state are united in the aspiration that we deliver for the president and we see that APC takes over the state. Now, time will come, and the time will be when the party, the president, stakeholders will determine. For me personally, whatever opportunity Mr. President sees that I can serve, either what I'm doing, or either local government, or anything else, I'm fully committed to the vision of the president to transform this country. And in whatever way I can serve this country, I will. But at this moment, I'm 1,000% focused on my job to deliver better health, the work that we have started, which is already beginning to make impact.
I mean, you going back to become a governor, you don't think lowers your profile? You haven't risen to that level, globally speaking.
My focus is to deliver what we are doing. That's what is ahead of me. Secondly, there's a leader in place, and he sees everything else. Yeah. And there are stakeholders around, and whatever we have that comes out of those consultations, that is to be done. But I don't have an aspiration that I would say that I sleep and I'm worried, okay, let me be this or that tomorrow. I focus on my job today. Thank you.
Professor Mohammed Ali Pate is the Coordinating Minister of Health and Social Welfare in Nigeria. Many thanks for coming tonight on the program. I appreciate the time.
Thank you. Thank you very much.
That's our show for today, everyone. Many thanks for watching. I'm Sean Okemale. God bless Nigeria.